released presentation, I'm very proud to present this topic about Plan Explorer. We have in our newest version reconcepted, redesigned, and an optimized Plan Explorer to bring your level of treatment on a better way. And I'm proud to see here Eric presenting this topic for us.
Yes, thank you so much, Björn, for the kind introduction. So, as you said, it will be the news in the version 2025, and also, the vision how we can go forward with automated treatment planning. Yeah, you made it work, so let's see if we need it. Okay, so this would be an illustration how it works today. We have built treatment planning systems for quite some time now with a lot of automation integrated, a lot of important algorithms to make plan optimization simple. But what is still remaining is that we're doing quite a lot of manual tuning of this. We start with some hopefully deep learning segmentation, but then we start to manually set up our treatment beams, set our optimization functions. We run the optimization, tune the weights, and so on. So it's still quite a manual task, and we're spending a lot of time in this kind of setting, which actually is not what we envision for the future. So if you rather think of having, next, this as the first step where you start your planning approach, this is where you meet the patient for the first time. So you open your treatment planning system and you have already a large set of different plans to choose from. With plans for based on your clinical goals, you can have it for different treatment machines, even different modalities and different treatment strategies. So sparing the rectum or sparing the bladder. And from that, you can then do a lot of choices and filterings and making this as the main comparison view. And to make this possible, of course, everything is automated in the process before and during the treatment planning process itself. So if we take the next slide, we will talk a bit more about the Plan Explorer workspace. What is it? What do we use it for? So first and foremost, we need to have somewhere where we can do an automatic generation of treatment plans. And for just setting up the beams and so on, we use the general framework of treatment protocol. So we use that to really create the plans, and then we launch the automatic planning. And those could be different, which we will see quite soon. We also have these very new exploration tools. So now, instead of having just one plan or maybe two plans that are competing, we could have 20 or even up to 100 plans, depending on what you really would like to do. And how can you then start to choose which one is the better? You have different plan scores, you have the filters, you have a cluster of deviations. You can really compare where you are with your different treatment plans. Next. And what is also important is that the normal plans that we create in Raysearch, we can directly transfer into this workspace. So it's really a versatile workspace where you can actually compare the different treatment types and modalities for different machines. Next. And I would really like you to think about this in the era of fully automated workflows. So if you think about the prostate case or the breast case, in total maybe 50% of all the treatments that we do with radiotherapy could be fully automated. We do automatic image import from your CT just by listening to the DICOM storage, SCP. Then it's followed by auto-segmentation and auto-plan generation. So everything is done in the background, and the first thing you do is that you come in here and see all your plans. That's the first thing you do in the treatment planning system. What about that? Of course, there are some more complicated cases. For example, the head and neck one. There, you still do the auto-import, auto-segmentation, But for the time being, we need to rely on the manual contouring of the tumors. Of course, that will come over time. That will also get tumor segmentation into our deep learning prediction models. But then maybe it's also with probabilistics maps that we put into our automatic planning, like robust planning on the probabilities of where the tumor is located. And then, of course, we follow with the auto-plan generation. We get these multiple plans and go for the Plan Explorer. Next, please. Next again. So just to take a step back and think about what is it we mean about automated treatment planning in radiotherapy as a whole. Of course, we need to start with a patient geometry, and that is done, as we have seen, by deep learning segmentation. We have clinical goals. Some type of delivery technique must be decided, the beam setup, and the prescription. And all of this can, of course, be done in an automated setup. So have this defined in protocols in the system by you and just put it. And then comes the automated planning part, which is this green box. And then we get one or several deliverable treatment plans. And since this is done automatically, we can now do multiple plans. You do it overnight on a server or so. So we're no longer confined to just making one plan. And of course, what is important is at the end, we still have the qualified user that will do the review. You can even refine the plans that you have selected by just using normal optimization on top of the automated part. And then you select the one you want, you perform your QA and deliver. So of course you still have some parts here, and this is also the savior, that we have the human in the loop to really take action and do the right thing. So we have two different types of automated planning in Raysearch that are fully integrated with the Plan Explorer. So we have deep learning planning, and we also have the ECHO algorithm. For the deep learning planning, we take the patient geometry prescription and the beam setup into account, and then we make a dose prediction out of this. This is the AI part, where we take a model based on many treatment plans from the past, built into a model, and we predict the dose for this specific patient. And then in the next step, we use the clinical goals, the delivery technique, and the beam setup to actually mimic this dose within an optimization. And this is not AI, and this is a huge benefit, because then we can actually also correct for some deficiencies or outliers in the predicted dose. And we get many delivered treatment plans at the end in the same case. And finally, the qualified user. In the other type, we have the ECHO. That we have more or less the same input here. But now this is more a general optimization problem, where we first, in the first step, try to prioritize the target and see what is feasible for target coverage. We keep that in the next phase with some leeway and try to minimize the organic risk dose instead. And now we end up with delivered treatment plans with a qualified user. So we really have two different frameworks for this. Next, please. For the deep learning planning, we have a large set of different models that are used in the clinic with brain, head and neck, lung, breast and prostate, rectum. And seeing breast and prostate here, as I said, I mean, for the fully automated workflows, we have 50% of the cases. We support all different treatment techniques. We have EMET, EMRT for photons, of course the helical part also if you go for tomotherapy, and for proton, PBS. And most importantly, we have already 5,000 clinical treatments with deep learning planning. So this is really happening already today. We work closely together with the clinics to validate and build the models. So it ensures that we really have a good coverage. For the ECHO planning, that's licensed from Memorial Sloan Kettering. I saw you, Daisy, here before, listening to Tit's talk. And he had worked on this for a very long time, and they have implemented it in their clinical practice at Memorial. It was done in Eclipse with scripts, taking about 30 minutes, very good results. we are able to do the same now, but within a few minutes. So reducing by a factor of 10. And it's really validated with thousands of patients already treated. It's also highly configurable for different treatment size, different treatment techniques, which makes this a very versatile tool. So they are a bit, different animals. The deep learning planning, very, very powerful and specific. Here we can tailor it. It needs some configuration. And it has been validated to provide these high-quality plans for lung, prostate, and paraspinals. So if we go back to Plan Explorer, so what we would like to do then in the different steps is that we first generate these automated plans. So that is done in this setup. And there we get many plans. We do optimize all of them, and we have the exploration phase. We still have all of these different plans, but we start to filter and find the ones that we really would like to go forward with. It might be 3, 4, or 5, so we mark them with stars, and then we start to compare these. So then we have few plans, and then finally we select the one that we want to go forward with. So in the Explorer workspace, after the plan generation, what do? We have this large set of plans that we narrow down. We have this display of the clinical goal fulfillment. So this is a spider chart, and each of the spokes, that's a clinical goal. So you can directly visually see which clinical goals are fulfilled and which are not. And you also get the plan score here to really rate them and sort them by the plan score. We have these exploration filters that can really take out different treatment machines, and also based on clinical goals. If you want to spare the rectum more, you push that clinical goal and the plans are getting filtered out. Also really powerful is the multi-plan DVH. Seeing all the DVHs from the different plans at the same time. It could be, all of them you have, probably it's most efficient if you have 10 or less, but very efficient. And then in the next phase, we go to the compare workspace, where we compare plans 2 by 2. I can scroll through all the different dose distributions, looking at clinical goals and DVHs 2 by 2. So finally, we look at how this looks in the program. So first, you create your exploration, and this is now a template for the exploration, and it creates all these different plans based on protocols. So you have already directly set up the different plans. And the next step is to optimize all these plans. This is now fast-forwarded, of course. It will take some time to generate a large number of plans. We got them, and now you can sort on the plan score. So we got the first plan, the best one was the echo case in this one. And it will also depend on the different parts. You saw that you could tick on the DVHs to see something, and also filter on clinical goals now. So now we drag on the rectum to lower the rectum dose, and only the ones that are fulfilling this clinical goal remain. Now I choose the ones I would like to continue with, and I get them in the compare space. So now I can drag them in and compare them side by side to make the final selection of the treatment plan that I would like to have. And you can compare different plans, and finally you select which one, and as I said, you could also refine it as a final step. So this is the whole idea of the plan exploration workspace. Of course, you will take a little longer time when you are not having it as a fast-forward film, but it is extremely versatile to really explore your big plan sets of different plans. So with that, I'd like to thank all the listeners, and if you have questions, you're welcome to ask it now or afterwards.
Any questions?
Yeah, any questions so far? Yeah, Eric, of course I have a question.
Yeah, I can imagine.
I can remember Plan Explorer the first time. It was more like a tool for big clinics to see, okay, what is the best treatment itself? What is the best machine out of it? What do you think about small clinics right now? Do you see there a benefit? I see a benefit, but can you explain the benefit for the small clinics?
Yes, I mean, it is a huge benefit for every size clinic, I would say. Automation will take over, and also for small clinics, it is extremely good to try to automate as much as possible, since you don't have so much resources also. So that's one thing, of course, that I really believe that automation is the way to go forward. But also in the normal planning workflow that you have today, you can also make a transition. Maybe do something automatic, but just use the Plan Explorer workspace as a comparison workspace. So you can see it as a plan aviation workspace where you have multiple plans. And you can even drag in plans that you crafted manually into the Plan Explorer. So I think it has many uses like this. And with the filtering and this comparing clinical goals, you can really find the plan that is most suitable for this patient.
Okay. Any other questions? Okay. Eric, thank you very much for this very, very awesome demonstration of Plan Explorer and the power of Plan Explorer, and also to make aware that we have the best treatments and the best outcome for our patients. Thank you very much that you attend this webinar and also the webinar series here. I will go over to, Thank you very much again for your audience. Feel free to book a demo or see Plan Explorer in real. Thank you very much.
Thank you.